Oxygenation consists of two types of tasks. The first enhances the patient's natural breathing pattern, such as positioning, deep breathing, coughing, and the use of an incentive spirometer. The other task includes the direct administration of oxygen. Oxygen is clear, odorless, and is contained in the air we breathe. Yet just as too little oxygen causes health issues, too much of it does as well. Oxygen therapy is given to patients who have hypoxia, a condition that describes a person who has a less than normal amount of oxygen in their blood. Hypoxia is diagnosed using a process that measures the oxygen concentration in the blood. This is called pulse oximetry. Pulse oximeters work using a sensor. That sensor attaches to a finger, toe, earlobe, nose, or forehead. A reading of 95 to 100% is normal. A reading of 85 is not uncommon for those with chronic diseases. Using a pulse oximeter includes the following steps. One, attach the sensor to the site and set alarm limits and pulse rate. 2, check and record the person's pulse. 3, read and record the oxygen concentration. Once a patient's oxygen concentration in the blood is assessed, a doctor may order oxygen therapy. To allow the oxygen to enter the body, the patient will need to wear an oxygen device. The nasal cannula and face mask are the most common oxygen devices ordered by doctors for oxygen therapy. Nasal cannulas allow for eating and drinking. When nasal cannulas are used, check under the nose and behind the ears for signs of irritation. The simple face mask covers the nose and mouth. The partial rebreather mask includes a bag that is added to the simple face mask. The bag contains exhaled air. A person inhales oxygen and some exhaled air from the bag. The non-rebreather mask looks similar to the partial rebreather mask. While a mask is in use, make sure to keep the patient's face clean and dry. Moisture can build up under the mask and can cause irritation. Also make sure the mask fits, but is not irritating the patient's face. Adjust the mask from time to time to lessen the risk of irritation, and remove the mask for eating. Be aware that oxygen should be treated like a medicine. Nurses and doctors are the only ones that can give oxygen or adjust the flow rate. To set up for oxygen administration, you will attach and prepare the flow meter and fill the humidifier. The nurse will check all settings before applying the oxygen. Working with oxygen in any environment greatly increases the risk of fire. Normally, harmless sparks can cause fires. Materials that don't burn in air can burn vigorously in oxygen-enriched air. Oil and grease can ignite spontaneously and burn violently. To prevent any risk of fire, follow safety rules when setting up for oxygen administration. When assisting with oxygen therapy, always check the flow rate of the oxygen. If the flow rate is too high or low, tell the nurse at once. Report any irregularities to the nurse. Signs may include an increase or decrease in the rate of respiration, or a change in mental status. Patients may lack consciousness, or perform vigorous movements with their arms and legs. They may also begin to pull at their own clothes. Oxygen is a basic need required for life. Providing effective care for patients with oxygen needs helps them use their own bodies to heal, and in turn, helps patients live healthier, more independent lives.